Hey everybody, thank you so much for joining us for our Facebook Live. This is again one of our community conversations here at Atlantic Health System. And once again, I'm excited to be joined by our President and CEO, Brian Gragnolati. Brian, thanks for agreeing to do this again.
Thanks, Luke.
We covered a lot of ground last time, but for those who maybe haven't had a chance to see one of these before, Brian and I are going to chat for about half an hour. We've got a number of topics we want to touch on. We also have received a number of questions from all of you, and so we'll have an opportunity to touch on a number of those too. So again, this is live now, but this conversation will exist on our Facebook page in the thread of material there. So if you miss some of this or can't watch the whole way, you can watch the whole thing later on. So let's jump right to it.
Sure.
A lot has changed really in the last 2.5 weeks since you and I last spoke in this format, roughly almost 3 weeks. And so I'm wondering if we can start with just sort of a level set. Like, let's talk about kind of where we are now, what we're seeing in terms of how our system is coping with this pandemic as it's evolved, and then we'll kind of go from there.
Well, I think probably the first thing that's different is you and I are both wearing masks.
That's right.
And that's part of, kind of this iterative process of trying to find our way through this virus and how do we socially distance things. And I think that this mask is symbolic of something that we've really learned, is that the mask doesn't necessarily protect us, but it protects others. And really that theme of how do we protect others from the virus is one that carries through all of these conversations, and why social distancing still remains the main tool that we have to effectively fight this virus. And social distancing is actually kind of what's leading to the story about where we are today. So our peak in terms of hospitalizations was on April 9th. And that was also what was predicted by our internal data analytics, where we were taking a lot of clinical information, comparing it to different models, and really looking at that. Because if you recall, at that point, although it seems like it's a year ago, we were fighting desperately to make sure we had enough protective equipment and to make sure we had enough ventilators for our patients, and that we had enough physical capacity. And I'm pleased to say that we threaded the needle. Our team did just an amazing job here at Atlantic, working through a very difficult period of time where we weren't sure we were going to not see this continued doubling every 3 or 4 days. So we peaked on April 9th, generally within the system. Western region was a couple days later. But as we went up really fast, we're going down really slow. And
so it's not like a true up and then...
No, this is not a peak. Right. It's kind of a plateau. And heading down right now, we see every day in our command center calls reports out that say, well, maybe we're down a few cases here, a few cases there, a little more there, maybe we're up a little bit. But if I compare from our peak, April 9th, to today, we're down about 35% from where we were. Wow. Now, that still means that today, this morning at the command center call, we had 544 patients in our hospitals. But we are at a point where we're getting close to having an equal number of patients that don't have COVID in our hospitals, and that's a very encouraging sign. The thing that we are still, though, experiencing is that we have a lot of patients in critical care and a lot of patients on ventilators. And it shows really how difficult of a disease this is, this virus. And when people get sick, they really get sick, and they stay on ventilators for long periods of time. But the good news around all of this is during this period of time, we've had over 1,700 patients who have transitioned into recovery from being inpatients, and many of whom were also in our critical care areas. And we've birthed over 1,000 babies, which I think is a symbol of the fact that we are open for normal care. And I know one of the things that one of the questions you had is really about that, and we can probably pursue that more during today's conversation.
Yeah, I was intrigued as to how much interest there was in that, and I think it's reflective, and I'm interested in your take on this, in people's sort of state of mind. They've been, as you said, it's been, since early March, we're going on almost 2 full months of this. Folks are looking to return back out, get the economy started, return their lives to something that resembles more normalcy. I think that's where a lot of that interest comes from. Is that, do you find that to be the case? Do you think it's reasonable to expect people are looking now to see what the next chapter of this is going to look like?
You know, I think to some extent that's the case. But so this morning I was doing some reading, particularly around some consumer research that was being done. And one was a piece by PwC. And they did a survey, and I have it here right now, over the last couple of weeks. And one of the questions was about social distancing. And you know, I'm on the edge of the baby boom generation here.
Without disclosing your
And you know,
age.
I also know that you know, folks in that generation were always viewed as rebels, kind of not following rules. Well, I got to tell you, based on this survey, folks in that age category are absolute rule followers in terms of how they are adhering to social distancing and how they're that principle of following it. 95%.
Wow.
65 and older believe and are following social distancing. Now, I'll compare that to some of our younger colleagues, like kids in my children's age group, that range from 58% to 68%. So we got a lot of work to do in the younger range, but all the old folks, y'all are doing great. But that has a consequence, because that's also the same group that is in need of chronic care management.
Right.
And one of the big concerns that we have today, and you saw some articles in the last week, whether it was in the Times or the Post or even in this morning's Star Ledger, about people not getting care that they need. And we see that in our own delivery system. You know, our doctors and staff in the emergency departments will tell you that patients are coming in sicker with some of these chronic conditions. And these are non-COVID patients. Our paramedics are seeing that when they go out to the field. You know, the number of times that they're pronouncing somebody dead in the field is doubled over what had been in previous years. And we see it in our practices where patients are approaching the medical system now and their doctors in ways that they're sicker than that they needed to be before they contacted their doctor. So we have to really impress, and through things like this, the fact that if you're not feeling well, or if you have a chronic condition that needs to be managed, work with your doctor, work with your caregiver to make sure that you're getting the care that's needed. And if you don't have a caregiver, you don't have a doctor, and you're worried about something, contact our call centers. Connect into the medical system, because we are open for care and we're open for safe care.
And I want to touch on one thing real quick, in fact, because it's about that point specifically. We took a question from somebody who was under the impression that, first of all, they didn't know what the status of our emergency rooms were in terms of open or closed. But then somebody actually said, are your hospitals just for COVID patients, or can anybody go there? Right. Let's clean up any misconception that exists right now on that front.
So our hospitals are not just for COVID patients. As a matter of fact, as we look at the census at Morristown today, over half of the patients there do not have COVID. And you know, our census is continuing to build as this built-up care is happening, and more people need urgent care and urgent procedures and emergency procedures and things like that. So it is not the case. And I think almost every hospital now has crossed over that point where over half of the care are for non-COVID patients. And that's a myth that we need to debunk, because when you watch the nightly news or you get on cable news, appropriately you've seen our stories of our heroes working in ICUs and working in the emergency departments and doing everything they can to provide care to COVID patients. And that's what's imprinted on people's minds. But make no mistake, we are here for all care, and we can provide that care very safely, and you shouldn't hesitate to contact your physician or dial 911 if you're in need, because if you don't, the consequences can be enormous.
I want to switch gears ever so slightly to the topic of testing, because that's another one that we got a number of questions about. And I think let's take it from twofold. One, in terms of the importance of testing as it relates to being able to provide care to folks, what we need to know about people and their conditions. And then the importance of testing as we talk about reopening the state. I know Governor Murphy, just as recently as yesterday, talked about what that process might look like. From where we sit, from our perspective, how essential will broader testing in various forms be to that process?
You know, I've said this over and over again, that testing from the very beginning was a problem. I remember the days when you had to go through the state and then you had to go through the CDC to even be allowed to do a test. Now that changed very quickly, but that's when the state was doing 22 to 50 tests a day for the entire state. Now that eased up right away because it didn't make sense, and everybody responded to that. And then we went through this other cycle where it was taking us 4, 5, 6 days to get a test result because there was such limited capacity. And then we went to the period where we fixed the capacity issue a little bit, got more labs online, but then we had a product problem, running out of swabs, running out of medium, running out of transfer kits and things like that. We've solved some of those problems right now to a point where in our hospitals, starting this week, we're doing, through a vendor called Cepheid, we're doing point of care testing in our hospitals. But that's limited too, because there's a limited supply of the test kits that we use. And going forward, it's going to be a problem, because as we open up the economy and social distancing begins to change, we're going to see outbreaks in particular areas. And the immediacy of getting on that outbreak is going to be predicated on having the ability to get a test right away and get those results right away. And as the governor said, we are not there yet. And that is the single biggest issue that I think is going to face us going forward, is having access to testing and then having the public health infrastructure to make sure that we can do contact tracing. In other words, finding out where the outbreaks are and how to trace them back to the source to try to contain it so it doesn't spread broadly going forward. And until we get that right, we're always going to be on this edge, because ultimately we still don't have a single medication that we know treats this virus effectively. There's a number of candidate medications that people are looking at, antivirals, but we don't have that magic bullet or that silver bullet. We also don't have what is ultimately needed, which is a vaccine. And that vaccine could be 12 to 18 months away before it is in production and then able to be administered to the population. And we can't keep the economy closed that long. There's a balance here. So in order to do that, we've got to have these structures in place. And I think what the governor laid out yesterday is a very thoughtful approach to moving forward, and we need to work through that. But again, it's about the testing.
The end of the day. And I wonder, with that in mind, with the fact that that testing infrastructure isn't in place yet, and the idea that we are very seriously, both as a state and a nation, looking at reopening, how are we positioning ourselves as a health system to continue to be able to deliver care? And I know that you mentioned PPE very much in the beginning. I know that the pursuit of that still continues. So let's talk about how we are remaining at the ready, and I also want to touch on how we're helping our team members stay resilient and mindful through that process as well. But let's start with some of the more nuts and bolts stuff. We're not walking away from COVID care entirely, obviously, as a system. So how are we remaining ready?
No, we can't. So if you think about this phase that we're in right now, well, we're in reacting to the virus, right? And I've got it socially and properly.
These are not built, folks. I'm sorry for long dissertations, so we have to kind of keep tugging. But we cleaned our hands with hand sanitizer before we started.
Or for people with noses that don't necessarily fit into this.
Yeah, well, that's part of the beauty of hiding it behind.
So, but if we think about where we have been on this, we've been in an all-out fight against this virus and trying to bend the curve, as we described, as this was being transmitted in a way that none of us even imagined. I mean, this has been just incredible. So now we're at a point where we've got to, and I describe it as a forest fire. We've been fighting a forest fire, and now we've got to move into a point where we're pretty sure we've got that forest fire contained. And again, going back to the governor's criteria, that means that we've seen a sustained downward trend in these cases over a period of time. And we've got to be ready to do the spot checks and make sure that we can really tamp out those areas where we see the flames come up again. But part of that is making sure that we have stand-ready capacity and that we've learned through this process. So here at Atlantic, what we are focused on is, as we have scaled up to care for COVID patients, we are now in the process, as our activities are going down on COVID, beginning to bring that back into a narrower band, because we will have the responsibility of caring for these patients until a vaccine is here and this becomes just a more common virus that can be dealt with in that manner. And that could be a year, it could be 2 years, and that's what we need to be in. So as we think about having the facility capacity, we're beginning to shrink down the number of physical places where we care for patients who are positive, so that we can have areas where we don't have a crossover population, because people are concerned about coming into a healthcare facility that they're going to pick up the virus. And I can tell you that that is not the case today. And it will not be the case going forward in terms of the way we're approaching this. The other thing that we need to make sure that we do is that we've got the right team members in place to be able to care for both the patients who need more routine care, but those who need intensive care. And we're working hard on that. But we also need to be in a position to have a plan to scale that back up in the event that we need to do that. Because there's been some discussion about flu season coinciding with a recurrence of COVID, and we all hope that that doesn't happen, but we need to be prepared in the event that it does. Your comment about protecting our team members with equipment is an important one, because at the core of that protection is this personal protective equipment. Different masks than this, gloves, gowns, etc. We learned that we just didn't have enough. We have to stockpile them. And we're in the process of doing that and also working with the state. We also need to make sure that we have the testing on site. And as I said, we're kind of getting there, but we're not there yet. And we have to make sure that we've got ventilators and medications. Again, we're buying up as much as we can to have that in reserve in the event that we do this.
For lack of a better term, the stress on team members, the difficulty of this process of caring for these patients over these last few months is very real. And we have seen moments of great triumph, right? The clap outs, and we've seen how profoundly positive an effect that has on team members. You mentioned the number of returns of folks recovering
Right.
from this disease. How important is it that we continue to keep our eye on that issue of making sure that our team members are able to be able to express themselves and receive the care they need too throughout this process?
That's critically important. Dr. Peter Bolo, who is the chair of psychiatry at Overlook, and just an amazing person, has done some work for us on resiliency. Mm-hmm. And this was pre-COVID, and how do you care for the caregiver? Because those are important issues. Because healthcare is not easy work, but as Trish O'Keefe, who is the president at Morristown and nurse, and actually the chief nursing executive in our organization, described to me, there are two issues that we're facing with this outbreak. One is the ability to put it in a compartment, like we do many times, as I did when I was an EMT. Something happens, you say you did the best you can, you got in an apartment. Well, you can't get away from COVID, right? You worry about it at home, you worry about it with your friends, you worry about when you go in a grocery store. Sure. The second is this notion of isolation, because we cannot interact necessarily in the same way we have had to interact or had the opportunity to interact in healthcare. The clap-outs are part of that. Yeah. The music that happens overhead, it's how do you break that isolation. But ultimately, that isolation's there. And so Dr. Bolo did a very nice piece on Workplace, which is the Facebook equivalent that we use to communicate with all of our team members. And it's 10 minutes. I watched it on Friday, and it explained a lot about how I'm thinking about things. And I'd encourage everybody to take a look at that. Yep. Because this is a time like no other. And if you're not feeling anxious, or you're not feeling a little uncertain or uneven, I would argue you're not paying attention. So,
something you mentioned earlier, and I think is a
and part of that, and one of the things that Dr. Bolo does mention are all the resources that we have for our team members. And I know that there are daily sessions where people can come together virtually, have these kinds of conversations. We have hotline resources. We can get employee assistants engaged right away, and we absolutely have to be there because this is a critical issue.
Something that I know that we've gotten a couple questions on while we've been chatting, and something that you mentioned earlier I think is it's worth drilling home on. There are a lot of different treatments and medicines that are under discussion right now that are possible, that people have a lot of interest in, right, which is understandable. And I know that Atlantic Health, from a research perspective, has put a priority on being involved in a number of those things. But I think it's important to remind our folks who may be watching that it's not everything works for everybody, right? I mean, I think that there's a certain measure of approach we have to take to something like this. How pleased are you to see Atlantic Health embracing this research and I mean, obviously your thoughts on where we kind of go from here?
Yeah, there's a lot of fact and myth out there, and one of the things that I am so very proud of is the fact that we follow the science, but we also follow the judgment of our physicians. And we have a great team of physicians here, an exceptional team of doctors that are really thinking through what these alternatives are with the ultimate aim of helping a patient. And they're balancing the risk and reward constantly and understanding, is this going to do more harm than possibly it's going to do good? So we're running a number of trials under that rubric, and we're looking at things that help patients who are on ventilators. We're looking at things that would help, medications that would help people who are earlier stage and less severely ill. And we'll continue to do that because we need as many tools in our toolkit, but ultimately it's got to be a physician decision, and that is critically important. And we have a very good structure in place to support that.
Stay tuned, folks. Obviously, over the weeks and months to come, I'm sure people will be hearing a lot more about that, whether it's the plasma treatments and all of that. So I want to, there was another analogy that you used, and as we kind of look to kind of come down toward the end of our conversation here, you and I talked a little bit the other day about what normal is going to be like, both from a healthcare perspective, but then for our communities as well. I'm a big sports guy. I'd love to think that we can all go to sporting events or movies, theaters, and all of that, and that life will return to normal. But you mentioned to me that normal may not be the normal that we're used to, and that this idea of this concept of this being a tide that we're dealing with. I'm wondering if you can kind of share some of your perspective on as we look forward and get through this together. Will normal be normal? And if not, what are you thinking about as we move forward here?
You know, as it relates to reopening the economy, it's more like a dial than it is a switch.
Okay.
You know, think about a dimmer switch, right? Okay. It's more like a dimmer switch than it is, you know, the lights on or off. And that's an important principle, because this virus has taught us all that it's unpredictable and it could be overwhelming. And I think about it as a tide. And we have been fighting this tide. We have been fighting this tide, and we've been trying to beat it down to a point where it doesn't overwhelm the healthcare system. And we've threaded that needle at Atlantic, and it looks like we're going to thread that needle here in New Jersey, and it looks like in other parts of the country, because of the early interventions that were taken on social distancing in those areas, that it's probably tamped down. But we have to be careful that we do not go back to a point where that tide, which is now receding, comes roaring back at a higher level and overwhelms the system, because that will truly, truly, truly be a disaster. And so when we think about what we have to do in terms of new normals, we know social distancing works. We're going to have to keep that in place. Now, what will social distancing look like then? Hopefully it'll be a better mask that stays on my nose. But at the same time, we're probably going to need to continue to not have huge gatherings and be, you know, in a concert or in a bar listening to music elbow to elbow. That might not be a good idea. We're going to probably go into restaurants and have disposable menus. And instead of a restaurant that seats 100, maybe it'll be 50. Right. Now, what's going to be the consequence of that? And then here in healthcare, we've got to keep using telemedicine. You know, one of the things that we have seen is an enormous uptake on telemedicine. And what I mean by that is in our practices, on any given day, I think today or yesterday, we had 3,500 telehealth visits and about 500 person-to-person visits. Now, that's going to get back in balance as we get the baby boomers to start coming back to their doctors. Right. But we know that that's going to be a new normal. And so it's going to have us think differently and act differently in healthcare. And I think you're going to see that in all sectors of people's lives.
When you, as sort of a final thought here, when you see those clap outs and you see folks celebrating life, right? And how inspiring is that for you, and how reaffirming is that for you of the work that happens at Morristown and Overlook and Chilton and Newton and Hackettstown and all those places across our system?
You know, at the very beginning of this, I was rounding over Overlook, and I remember talking to a nurse who had discharged one of our first COVID patients. And I remember talking to her about that, and she said, you know, this is what I trained for, this is why we're here. And I continue to see that spirit displayed in so many ways. And there were so many times that we could have stumbled because of the overwhelming levels of volume and the stress on the system and not having potentially enough vents, and how do we innovate around that. And I saw our teams come together in ways that you would have dreamed about and done it with an agility and a speed that is healthcare is not known for in terms of change. One program in my mind that got set up, which was to try to make sure we had capacity in the system, was this Oxygen at Home program that Carol Vargas and Dr. Klus and a bunch of other people set up. And I think we have 60 or 80 patients probably in it today that don't need to be in a hospital. That's innovation. And then I see the work that our physicians are doing to find exactly the right treatments for something that nobody knows how to treat. And then being able to share that broadly with their peers. And I see, you know, and hear about the conversations that our team members have acting as surrogates for a family when somebody is passing, and how we use that. So, you know, Atlantic's an amazing place.
Folks, the topic or the title we chose for this was talking about the way forward beyond COVID, and I hope you had an opportunity to hear some things today that illustrate both from Brian's perspective and from some of the things that's happening at a statewide level as to how that's happening. Doesn't sound like it's going to be overnight, but we're moving in the right direction.
Yeah, and you know, quite frankly, if we treat it like it's going to be overnight, we're going to be back in the soup again.
Right.
So
well said.
I think we've got a great governor. I think the states are going to matter here, and I think we need to follow his direction, and we're certainly here at Atlantic supporting the efforts he's doing, and we're going to be there for our communities. But, you know, wash your hands, maintain social distance, and just use a lot of good common sense. But most importantly, if you're sick and you need care, we're open for business.
Thank you, Brian. I appreciate you sparing a couple moments.
Thank you.
Today. All right, folks, as I said in the beginning, this conversation community conversation will continue to live both on our Facebook page and to find any of the resources that Brian talked about today, go to our website, atlantichealth.org. You can do /together to find a direct link to some of those things, but this community conversation, a link to that is also on our homepage, and it's at that location where you can find so many things that I think will be useful for you as we continue to move forward beyond COVID-19 together. So thank you so much, Brian.
Thanks, Luke.
Thanks for watching, and we'll see you next time.